Hi, good evening and welcome to What's New in the Queue. I'm happy tonight to be able to bring to you Harry Shulman, who's the President and Chief Executive Officer of the South Shore Mental Health for the past 30 years. Mr. Shulman has provided strategic direction to the organization, establishing the South Shore Mental Health as one of the largest regional providers of behavioral health services, serving over 16,000 individuals annually from Boston to Cape Cod in the areas of education, treatment, and recovery. Under his leadership, South Shore Mental Health has become a provider of choice for the delivery of managed care, behavioral health services, and all of the major public and private insurers. And I'd like to welcome Harry to our show tonight. So welcome, Harry. How are you?
Well, thank you very much. Thank you for your invitation.
Yeah.
Pleased to be here tonight.
It's great to have you. So what we were hoping to do was have you on and just briefly help us in the city and surround to understand and learn a little bit about South Shore Mental Health. So maybe you could describe South Shore Mental Health and the programs and services that you do provide to your clientele.
I sure could. Well, we were founded back in 1926
Wow.
by a group of residents in Quincy who wanted to be able to provide some counseling for children in the school system, in the Quincy school system.
Something very near and dear to my heart.
Right, who were having some difficulty. So
Yeah.
it really goes back to some grassroots effort, and we're now 87 years old.
Wow.
We are a private, nonprofit, charitable organization. And as you indicated, we provide a broad range of services, and
Right.
it goes to all age ranges. We provide services at our Step 1 Early Intervention Program for infants and toddlers. These are children between the age of birth and 3 who have developmental disabilities or developmental delays. We provide a variety of therapeutic services, and our goal is to prepare them for when they enter the school system at age 3.
Right.
We also, on the other end of the age range, provide services for seniors. We have an experienced group of clinicians who do consultations in nursing homes for patients, many of whom are experiencing depression. And we're also in the process of developing relationships with South Shore Elder Services and other senior organizations to provide mental health services to their clients.
Sure. So it's very helpful because obviously we have a large population in the city of Quincy of seniors too, and I think sometimes what people do forget is that can come with some major changes in their lives too, and how they deal with some of the things that they're dealing with. It can be some depression can kind of come into play when major changes are happening in their lives, and let's face it, when we are faced with changes, we don't want them at that age. We want things to be comfortable and easy for us to be able to maneuver our life, because we've earned it at that point. But
absolutely. We want to enjoy their retirement.
Yep.
And if one is depressed,
Yeah.
we find the treatment really works.
Right.
Individuals could get better within 6 months with a combination of therapy and appropriate medications.
Right.
However, individuals who don't seek services can really experience a life in their elder years that is not what they expect.
Right. And it's hard for them to talk about it. So by going out and actually working with those specific target audiences, then you're able to maybe offer services that they weren't really aware that they could have, that could help maneuver them out of that situation.
Right. I think part of it goes back to they come from a generation where it was shameful sometimes to seek mental health care.
Sure.
There was a stigma.
Yeah.
So we're dealing with that issue, trying to overcome that barrier. That
Right.
is the number one barrier for many people in accessing care.
Right.
But we are seeing some change in younger generations.
Absolutely. And the early intervention, what would be some of the cases that you might see? I mean, low birth weight or early in.
Yes, babies who are born early, and we often will receive referrals directly from their pediatrician.
Right.
There are also children who may not be developing consistently with their age level. They may have certain skills where they're doing fine and maybe 2 or 3 skills where they're behind.
Right.
So we're able to provide them with services through funding from their insurance company,
Sure.
or at the Department of Public Health is the payer of last resort if they're not insured.
Excellent. And that also kind of goes right into, once the early intervention, they go right into a school environment too, right up to age 3, and then they move into preschool and they get provided services through the school system
Exactly,
as well.
and that way we build upon the services they received from our Step 1 program and the children don't lose the benefit
Right.
of early intervention.
So it's really important if a family is experiencing or questioning things when their child is young, not just because of low birth weight, but just questioning developmental stages with their pediatrician, to seek out those services, because the earlier you provide that child the opportunity for services, the better off they are in the long run
Absolutely.
for educational opportunities. And as we all know, early intervention is actually long-term solutions for, and every child has an opportunity to succeed.
The research really tells us that for every dollar we invest in early childhood education, like early intervention, we save $7 going forward, avoiding high costs for special education, or children growing up and getting into the criminal justice system, or not having the skills for employment. So it really is one of the best investments we can make in early childhood education, and Governor Patrick has indicated that's one of his priorities in his budget for fiscal year 14.
Well, I'm very excited to hear that, because it's something that's very near and dear to my heart. I actually had a nephew that was born very premature, and we were told he would never walk, talk, or do anything, and he's actually in his master program right now.
Isn't that amazing?
So it is amazing, and he was 3 months premature. So through early intervention and through a lot of the surround care that he had through his educational opportunities, he's actually done very, very well. And I'd say there's a lot of successes like my nephew that are out there in the world through your help, through services that your social mental health has been able to provide.
And 30 or 40 years ago, he might have been institutionalized.
Absolutely.
And not had the benefit of early education programs, and not been getting his master's degree.
Absolutely, absolutely. Now, populations, when we talk about populations that you served, you touched upon some of the elder care, but what are the other populations that you're able to help? Are you reaching out to the Asian community or in-house treatments? Could you talk a little bit about those?
Yes, we have an Asian counseling service team. These are individuals who are very skilled clinicians, psychologists, social workers, licensed, who also are of Asian background. They speak multiple languages. And we provide counseling services in the Quincy area to about 400 families
Wow.
of Asian backgrounds.
So how do you obviously do you go out to the communities to be able to let them know that you're providing those services?
Yes, we've worked historically closely with Quincy Medical Center. We also work with South Cove Community Health Center, which really focuses on that population. Pediatricians and physicians are aware of the services we provide. We're always trying to educate them so that they will make referrals early to us.
Okay.
And we really want to have an opportunity for people to see us in Quincy rather than having to leave Quincy and go into Boston to get care.
Absolutely. So, and that's a full range too. That's from the young to old that you're working with in the Asian
Yes, we
community.
have many in our Step 1 early intervention program. We have teens in our counseling program, adults in our counseling program as well.
Excellent.
We have really a full range of services in the traditional South Shore area, from Quincy down to Hull.
Okay.
We provide emergency services for that entire population, and we do that 24 hours a day, 7 days a week. So anyone who is experiencing what they perceive to be a crisis can call us, and they can either come in and see us, or we have a mobile capacity too, where we will go to the home and be able to do an assessment and evaluation there. Many people choose to go to the emergency department, and we're always called in to do an assessment and evaluation. So if someone is in need of psychiatric hospitalization, we're the ones who generally make that decision and try to find the placement for them.
Okay. So if not, then do you have an in-home treatment that you're able to
Absolutely.
utilize?
So really our goal is not to put people in the institution, but is to try to find programs in the community that will allow them to really deal with the issues they're struggling with and to make progress. So we have a very strong mobile capacity at our agency, and this has really occurred over the past 6 or 7 years. If you go back 7 years, probably 95% of our outpatient services were provided at our clinic sites.
Sure.
Today it's about 50-50.
Wow. So it's really
we
changed.
have, absolutely. It's one of the ways in which we're making services more accessible to people, as well as more acceptable. What we were finding is many people who needed our service were uncomfortable coming to see us at a clinic, or had difficulty getting there.
Yeah.
They might have had other children at home, and what were they going to do with them? They couldn't afford a babysitter.
Right.
So that our in-home treatment program really resulted from a program that's sponsored by Medicaid.
Okay.
And again, we have trained clinicians who are supervised, and they make home visits. They make visits at the school, or they may even make a visit at a Dunkin' Donuts to see a client.
So they really personalize it for them to make access available to them, so that it's not something that's a barrier for them.
Very personalized. In fact, in some of the situations, I've received feedback from families that the individual who's working with them from South Shore Mental Health is almost like a family member.
Sure.
So they're there really not only to work with the child, but to support the family.
Right.
And that's another element, for example, in the Step 1 program. Not only the children benefit from that, but the families who have a child who has developmental delays or disabilities struggles with that in the beginning. They don't know what to do, and here they have the opportunity to see other families and feel more comfortable about
Right,
the support they're receiving.
To feel like they're not in isolation, because obviously the struggles that they're having feel very isolating to them because they're dealing with their child or their loved one that's going
Right.
through that. But in reality, many people are going through struggles, and to know that you're not the only one makes it a little bit more accepting. It makes you feel a little bit more comfortable about talking about it too.
Sure.
And then I think the other thing that's really beneficial for something like that, and you can tell me if this is factual or not, but that once you have somebody that's experienced the positive side of therapy, whether it be early intervention or even a senior care situation, by communicating that to maybe friends and other people, you open the doors for other people maybe recognizing a problem in their own home or in a family or friend's home, that they can provide the services and actually reach back out. Because oftentimes, more than not, people that need help may not know how to get help.
The number one referral source from us are our clients. They do, once they experience the benefits of treatment, and they know friends or relatives who are in need, they often will indicate, well, why don't you call South Shore Mental Health?
Right.
So that is a very important way in which we communicate the work we do.
Yeah, and that's very important, because I do think, like we started this by talking about seniors and saying that it used to be a stigma to not want to reach out for help. I think a lot of things have changed too in the last, would you say it was 89 years that the South Shore Mental Health
86.
86 years.
Oh, well, it's 87 now.
87. I added on a couple of years, but 87 years ago. Obviously, Quincy was forward-thinking enough to recognize the need, and those barriers have been slow to break down, because as the need is there in the schools, it has developed into other areas too. But it's great to hear Social Mental Health has expanded its services for the people that do need it. So we talked a little bit about your Asian counseling and the IHT and services. Social Mental Health obviously serves over 16,000 children, families, and adults each year, and we do want to talk just a little bit about there seems to be more that are needed in services in the barriers. So why don't we talk about something we just talked a little bit about, but barriers and how we can help people who might need them to get that care.
That really is one of the most significant issues we deal with,
And how do
because
you educate
we
people, I
know
guess?
from national data done by the National Institute of Mental Health that 1 in 4 people will experience a diagnosable mental illness sometime in their life. But of those, only 1 in 4 actually seek treatment. And even less seek treatment from a mental health professional. They may only get it from their primary care doctor, who has
Right.
limited capacity to deal with those issues. So part of our strategy is to educate people about the work we do, to make our services very accessible, and to reduce the stigma of seeking mental health services, the number one barrier for people to get care. So one of the successes we've had is by doing some of the mobile work in home treatment. Over the past 5 years, we have increased the number of clients we serve by 1,000 a year.
Wow.
So we've gone from 12,000 people 5 years ago to 17,000 people now. That is the largest percentage growth in our history. And it's due primarily to our clinicians and our staff moving out of their offices and going
Into
to
the
where the
homes.
clients are. And we're finding that many families, especially families with multiple issues, really appreciate that kind of intervention
Yeah.
and find it more accepting.
Now that helps not only just the family that you're helping with, but it could also help if it was a parent that's struggling and has a child in the house. It could also help with the child's transition back into the school, because sometimes what happens when there's a family member that is in struggle or in crisis, it affects the whole family. So I would imagine by doing that in-home treatment and being able to help that family, you're actually helping not only your client, but actually helping the whole environment of the family, and being able to maybe encourage that student to go back to school and realize that things will be okay at home while they're away for 6.5 hours in school.
That is really a significant benefit, and also we may pick up other needs that are in the family. And one of the other major benefits is basically seeing what's going on in the family. You could see that better in the home
Absolutely.
than you can in an office.
The family dynamic is critical, because oftentimes too, like I said, it's a telltale sign of how everybody's interacting in the home too, and you're able to give maybe modeling mechanisms to be able to help the client, but also help the family kind of cohabitate in that house so that they can be all successful.
Another benefit is our in-home treatment is not once a week or once every other week. We're able to make multiple contacts during a week, depending upon what the needs are of the family, of the child that we're working with. But let me also say that our clinics are very active. We have 2 clinics in Quincy. We have one in Wareham, one in Plymouth, and one in Marshfield. And the population we serve there is extremely broad, from chief executive officers of corporations to individuals who have longer-term mental illness. But basically, the clinic's a short-term treatment. The average length of time that people see us are 7 or 8 sessions. And if they have to come back in another year for those sessions, that's fine too. And we also have clients who have been with us for years who have more serious and persistent mental illness. So we really cover the broad range of people in the South Shore. That's why we serve 17,000 people.
Right. And the other thing that you mentioned that's really critical for people at home to just consider, if you do go to your primary care physician and you're feeling depressed, let's say, and there's a medication that they prescribe to you, it's not a solution necessarily. And you touched upon it, that therapy combined with maybe medication is really the success that you might have. But there's the combination of being able to work closely with that physician. I know that's a struggle that we have just in general because it's a gap in care. But maybe you could talk a little bit about that and encouraging people that might struggle at home, if there's anybody watching us that might have that struggle at home, how to reach out and realizing why that is a gap in care that will be.
This is really one of the challenges we have, is to integrate mental health services with physical health services. Historically, we've been pretty much separated, and we're working very hard at our agency to collaborate with primary care doctors. In some cases, we actually have clinicians working in their offices, so that they're able to get a handoff of a client who comes in and needs mental health services right away.
Right.
We're working with community health centers, Manatee Community Health Center, South Cove Community Health Center, and we expect that as the Affordable Care Act moves forward, there'll be more of a push towards integration, and mental health will become part of the mainstream of healthcare. We need to connect the body and the head.
Right.
That's really what's very important.
You'd think we'd know that by now.
You would think so.
You would think, but it sounds like the governor knows it. So we just need
the governor and the president, and
I
think there's a very strong movement in that direction, both at the national level and at the Massachusetts level.
Yeah.
We're really ahead of the country in Massachusetts in trying to develop integrated system of healthcare.
Right. I think it's important to note, though, because when we're talking about that integrated healthcare system that we're talking about, because there are gaps in the way we're approaching it right now, it's really about creating a complete solution for people. Because when you're diagnosed with something, or if you're asked, you go to your primary care physician, like we said, and you get a prescription, that prescription isn't solving, it's self-medicating another problem that's actually existing. So that's where those two connection pieces really have to kind of integrate and work together, because there's some success, and I think you mentioned it too, the success once you put those two things together. Somebody who has been maybe diagnosed with depression and has those two things, what's the success of working together? It's
quite successful. The evidence shows that people get better within 6 months. Also, we're able to provide case management services.
Right.
So these are individuals especially trained to make continuous contact with people who need more than just one outpatient visit a week or every other week. And part of their job is to address the issue you mentioned earlier, is to comply with their treatment plan, to make sure they're taking their medication, to make sure they're taking it appropriately. We've heard stories about people having to make a choice between their medication and buying food.
Absolutely.
We want to make sure that is not a choice they have to make.
Right.
And only about 30% of the population actually take their medication as prescribed by their physician. And one of the things that we need to do a better job of, and we're working at it at South Shore Mental Health, is communicating with primary care doctors and internists. So we're currently installing an electronic health record so that we'll be able to communicate through a health exchange. Right now, communication is very, very hard. You ever try to call a doctor's office and speak to the doctor? we have a hard time doing that as well.
I know.
So what we're going to be able to do is basically, with the approval of the client, to share that record electronically.
Right. And that's always so hard too, because with the HIPAA laws, it's obviously electronic records are making it easier, but that was even a change that was really slow to come in the medical world. And now we're seeing, I think all medical offices have to be in compliance. If it wasn't this year, I think
it's in 2014.
2004. I was going to guess.
That's why we're working at it now.
I was going to say it's very close. I didn't think it was 13, but it's 2014. It's kind of like with the core standards for the schools too. So it's interesting to hear that, because I think that will be helpful to you with your clients to be able to really help them with their medications and help them monitor that.
And their primary care doctor will know, for example, when we've done a counseling session,
Sure.
or made a change in medication.
Yeah.
So right now, that is a gap.
Yeah, and that's a big gap, and obviously not all medications work for people, so it's important to be able to have those transitions happen while the care is going on.
And we want to make sure there aren't interactions between the medications being prescribed by the physician,
right,
and by our psychiatrist.
Yeah, because there could be multiple medications that they're taking that could counteract their other medications. Well, that's all extremely, I think that's been extremely helpful, and maybe it's even cleared up a few questions that I've had. But one of the questions that I have for you is, because you have been in the mental health field, you've been the CEO for 30 years of social mental health.
Yes, I have.
Which is, thank you very much, and it's congratulations. That's a very long career. But what have you seen? Because with that longevity in that position, you've obviously seen many changes. So what are some of the major changes that you may have seen during the course of your career, both positive or negative, or things that you'd like to see? Because we all want to make things get better.
Sure.
But we've also had to have the struggles throughout the years of maybe having some things decline, not because of what we're doing, but because of other people's choices. So maybe could you just enlighten us?
It's been an amazing transformation since when I started. I actually started my career in mental health about 40 years ago. I was inspired when I was in college by President Kennedy, who signed the Community Mental Health Center Act to really provide services in the community. Back then, in the early 1960s, most of the care was provided in institutions.
Right.
Over 90% of the state budgets across the country were for institutional care. And the Community Mental Health Center Act that President Kennedy signed was actually the last piece of legislation he signed.
So it was an important piece.
It was an important piece, important to him and to his family. So
Yeah.
it really worked for clients with both mental illness and developmental disabilities.
Right.
So what we have seen as the kind of the major public policy shift has been the focus of serving people in the community where they live, rather than in institutions.
Right.
So back in the mid-1950s, there were 25,000 institutional beds run by the Commonwealth in Massachusetts. Today, there are less than 1,000. So the vast majority of people who we see, we're able to treat in the community. We have a number of residential settings that we operate. We have over 200 clients who receive our residential services. Some of them in what's a community residence, where it's staffed 24 hours a day.
Right.
And others who are living in their own apartments and receive support from us as needed. So the community first concept is what I see as one of the major overarching changes. The other change we talked about a little was stigma.
Right.
We're finding that people are much more willing to seek care these days, whereas historically it was perceived as a weakness, but it's actually a strength for people to seek care. It's really their first step towards changing their lives for the better.
Right.
So we are reducing stigma, and the other thing that we also have done over the years is to reverse the discrimination towards the mentally ill. There were all kinds of limitations on the kinds of mental health care you could get that aren't the case in physical care. So with the passage of the Federal Parity Act and the Massachusetts Parity Act, individuals who were seeking mental health services have the same rights to care as if they were going in with a broken arm or a heart condition or cancer.
Right.
So
as well they should.
So more services are available now.
So you've seen a real growth in and the most important thing is, what I think of the stigma part is, again, it goes back to communication and families who have had success, sharing those stories and enlightening others that if you're struggling, And there are people who do struggle, and it can be something that can be, if you just have somebody to talk to,
Sure.
it can enlighten your day. It can take the load off for a little bit.
I could tell you my own personal story,
Oh,
briefly.
You could. Well, I'd love to hear
I
it.
grew up in a family where my mother was a manic depressive, and my father was an alcoholic, and I was often the caretaker for my mother when I was 10 years old. And I sought out a counselor when I had to make the decision of whether to go to college or away. And that counselor made a big difference in my life, and
Yeah.
really was my first step to be able to have a career helping others live successful lives. So I know what it's like to live in a home where there is struggles, and also the benefits of counseling. It didn't take very long for that person to convince me that I really needed to take advantage of that opportunity.
And to go away to school?
I did. I went to the University of Massachusetts in Amherst and got my bachelor's degree in government, and I got a fellowship from the National Institute of Mental Health.
There you go.
And got my master's degree in social work at Boston College.
So you became the caretaker to multiple people because of that. So
I certainly have.
because of what you learned. And the
Right.
thing is what you learned was that it was okay to reach out and get help, and then you were able to help a lot of other people. So we're very lucky that you were able to do that. And it does show strength and character to be able to recognize that you can love somebody and help them, but then also realize you have to help yourself. So
I'm
thank
able
you.
to do that, by the way, not myself.
Yep.
I have 650 employees who are extremely dedicated and committed to the work they do. And they are the reason for the success of what South Shore Mental Health does for the communities we serve. And we provide services from Boston all the way to Cape Cod.
Yeah. I'm always amazed at that. And one of the things I was invited, actually, I knew about social mental health, and I was invited to something called Building Hope and Changing Life Sessions.
Yes.
So I was hoping that maybe you could tell us a little bit about this, because again, as we talked about communication and learning, I knew that the social mental health had helped students in our schools, and I do often like to reach out and learn a little bit more about what it is, the services, and coming from a family that's not afraid to reach out to say that we need help, I wanted to learn a little bit about it. So I was invited to one of your morning sessions. So what is Building Hope Changing Life Sessions, and what would they be about? And we'll put the dates and times up, but that's just if people want to learn more about social mental health.
We started this program because I was getting tired of hearing that South Shore Mental Health is the best kept secret on the South Shore.
I could imagine it, especially after 30 years, and you want people to know about
That's
it.
right. It's serving
That's why we have you.
17,000 people a year. I said, how do people not know about us? So we did
That's
develop.
why you're on the show tonight.
We did develop this program, which is a small group session. We generally invite 10 to 12 people to come to these sessions. It's totally voluntary. It's not a fundraiser.
No.
And we tell the story of South Shore Mental Health from the perspective of our clients and our therapists. So we have coffee, of course, and then we might have a testimonial from one of the people who've actually used our services. We may have a story that a clinician tells about work that they've done, and generally we pick some cases that people might relate to, might feel as though, well, gee, I know my uncle dealt with that problem, or my niece has this, and
It's relatable.
it's relatable.
And it's helpful.
And the program runs just 1 hour. And we call people after the session to get their feedback. And the one major comment I always get is, I didn't know that South Shore Mental Health provided all those services.
Right.
So 10 by 12 people twice a month, we're getting the message out.
Excellent. So if people at home, we're going to put the dates up if they want to get involved, and that they can call. We'll put the number up for social mental health. But if they want to schedule an appointment to come and learn a little bit about the Building Hope and Changing Life sessions, they can call, and the dates and times will be put up. And then also to schedule an appointment should they need services or know somebody who needs services, we'll also put your phone number up. But do you have the website that you could share with us too?
Yes, our website is www.SSMH.org.
Okay.
I also want to emphasize for our Building Hope Changing Lives, it's not just for people who are looking for services. We're trying to reach out to the whole community.
Right.
So we welcome everybody.
This is for people that want to learn about social mental health.
That's correct.
It's not necessarily that somebody that might, so somebody who needs services to be maybe on board onto social mental health for services themselves should get in touch through the website or make a phone call.
We have one number to call
Okay, what number is
for
that?
intake. It's 617-847-1914.
If you didn't have it right, I had it right here, so I would
Excellent.
have helped you.
I hope I would
you
have it right.
You do. You have it right.
So that's a one call for
Yep.
the entire Boston, the Cape Cod area.
So if there's anybody at home that feels that there's a family member or themselves or that just want to learn that feel they need services, that's the intake number that they would call. And if there's people at home that just want to learn more about social mental health, what's in your backyard, what the services are, and really just be educated on it so that maybe at your next cookout, should you feel the need to be talking about this, you can share the information that you learned at the Building Hope Changing Life sessions, and you might actually change a person's life by going to the session to learn more about what the services are. So, Harry, one of the things that we keep talking, and it might be me who keeps saying, I keep saying crisis. So, and when a family's in need and they want to call the intake, give a description of some of the things, some of the feelings that a person might have when they're calling, or issues that they might come to the table with.
Right. I want to emphasize that the vast majority of people who come to us are not in crisis.
Right.
They're dealing with a variety of issues. They may have anxiety. They may feel depressed. They may have a child who's not performing in school. There could be problems in terms of the relationship between the husband and the wife. We really deal with almost any issue you could think of. But our largest program is our program called Bayview Associates.
Right.
And that is a program that's focused on outpatient counseling, and it's not a crisis intervention program. Our emergency service program sees about 10 individuals every day.
Okay.
And
so it's really a smaller percentage of
right.
what you're dealing with.
And that's focused on the traditional South Shore, Quincy to down to Hull.
Down to Hull. So it's interesting to me, so one of the things when we were talking at the beginning, when we were talking about early intervention, and social mental health is the provider of early intervention. And what's interesting to me, I learned so much tonight, but early intervention to me was a different program because you had multiple different programs. And even when you just said Bayview Associates is where people do the clinic portion.
Yes.
So why is it that it's not social mental health? Was there a rational reason that, because I think that's where the disconnect is for me, where social mental health is the best kept secret, because there's all these
Right.
programs that I'm aware of, but I didn't realize there was social mental health.
Oh, that's a problem I think we created for ourselves. I think years ago, from a marketing perspective, we felt that if we utilized a name of a program without mental health in it, it may be less stigmatizing and that people may find it more acceptable. So we developed our outpatient program called Bayview Associates.
Okay.
So many people who go to that program, and that's our 4 or 5 clinics throughout the area, generally may not even know there is South Shore Mental Health. Certainly in our Step 1 early intervention program, their primary identification was Step 1,
Right.
not necessarily South Shore Mental Health. And that program is really not a mental health program, it's an education program.
Sure.
So the positive part was that we have grown the numbers of people we see substantially by over 10,000 over the period I've been there.
Sure.
But the negative part is that South Shore Mental Health is not as familiar to the broader population as the individual programs that we operate. Another one is our Discovery Day Treatment Program, or our supported employment program.
Sure. What's your Discovery Day? Maybe just enlighten us.
Oh, that's a program for adults with more significant mental illness. And it's a program that generally is funded through Medicaid, and people come 3 or 4 days a week to that program.
And then what's it's an employment program too?
The employment program really focuses on young adults. So we're helping them to learn what it takes to be able to find a job in the current environment. Many of them do have some mental health issues. And so we do things like helping them to develop a resume,
Sure.
how to dress. We also will
Help them
find
become
employment.
sustainable young adults, so they can feel good about themselves and actually be part of the community.
So we'll find them employment at various local businesses that are supportive, and we guarantee that the individual or some individual will provide that job
Right.
on a regular basis.
And see, with all of those different names, you definitely have a brand recognition problem.
We have a brand recognition problem, that is correct.
But
so
at the
in
same
trying to deal with the stigma, we've created a brand recognition problem for us.
Which is okay, and that's the reason why we're having this opportunity to have you on the show and to talk a little bit more about it, because you really don't. You have a great brand. Social Mental Health has a phenomenal brand, and you have a lot of services that you provide to so many different avenues of people who are in need for multiple different reasons, and it's important for people to learn about that. So again, like, I think that was that really kind of makes it understandable for why maybe we weren't connecting the dots, but there was a reason for it, obviously.
Another reason is we're very well known nationally.
Yeah.
We have large training programs at the agency. We have a psychology training program where PhD candidates in their last year come here for a year.
Sure,
We have
that's
many
great.
social work students come. So we have our students over the years placed all over the country. So our brand recognition as South Shore Mental Health is very well known
It's
in
very
the community.
in the community, in the most
Right.
in one of the more important communities, which is where you get your talent.
Right.
So that's important too. But I just wanted to maybe just broaden that just a little bit, so in case people maybe at home that might have recognized the early intervention and didn't realize it, now they can I'm sure they do now recognize that it's South Shore Mental Health.
Our website will help with that.
Absolutely.
And people could learn more about us on our website. If they want to give us their email, we're able to send them our newsletters, which we send out on a regular basis.
Absolutely.
And we also have a variety of other events that may focus on a specific topic. For example, we recently ran a session by one of our most senior psychologists that was focused on how do you deal with your children when a major event or crisis occurs,
Yes.
such as the marathon bombings.
Well, I know we had a major crisis in Quincy, and Social Mental Health came out and helped us too. And the crisis in the marathon, the recent marathon, crisis happen all around us at all times, and it can be a personal crisis right within your own home, and that's when you realize that you do need to seek help. So I really want to thank you very much. I hope you enjoyed it as much as I did.
I certainly did. Thank you very much for the
invitation. I appreciate it very much,
invitation.
and I hope everybody at home enjoys it. And like I said, reach out to Social Mental Health if you want to learn a little bit more about it. Go to their Building Hope and Changing Life sessions, and or if you know somebody that's in need of help, go to the intake line, and they're there for you. So thank you very much. It was great having you on, and I hope you'll come back again.
I will certainly do that.
Thank you.
So welcome back, Ann. That was a great discussion that you and Mr. Shulman had. I was really surprised. Social Mental Health, what, 86 years, I believe it was?
Yeah.
Was the number? They've been 86, 87?
I think it's 86. 86 years, yeah.
So that's that's some time, certainly, as get a service to the community.
It started a grassroots opportunity here in Quincy to help kids in school. So it really is amazing how progressive Quincy can be.
Sure. Yeah. No. Certainly. So again, encourage folks. If they are in need, certainly reach out to them. Reach out to them and others. And really get out there and get some help.
Sure.
So that's great. So Ann, I think we're past the graduation point at this point.
Yep. Congratulations to all the graduates.
Kind of amazed. Kind of amazed at this point that it's past us. So congratulations to your daughter Maggie as well. Maggie's a graduate of Quincy High School.
I know, it's unbelievable.
So it's amazing. I can't believe this time of year is certainly fun.
It's
fun for all folks.
It's been a fast 12 years in the Quincy Public Schools, and
wow.
It was a very exciting year.
Yeah.
So all the graduates, congratulations for those that were graduating from the Quincy Public Schools and also the surrounding schools throughout Quincy. We know a lot of those kids.
Yeah. So again, North Quincy, Quincy High School, any of the Quincy High Schools, Archbishop Williams, etc. I think it's great. Congratulations, and certainly a very happy time of year for a lot of folks.
Absolutely.
And we're going to get into the summer, and unfortunately it's a short summer for the kids this year, at least with the school year ending certainly. A little later due to the snow days, and then the 4th of July holiday falling after that, and I think it's a blink, and then it's Labor Day, right? So, but certainly enjoy it. Get out and enjoy the good weather.
It's not
Hopefully
a blink for me
remains.
It's never a blink for me in the summer, Mike.
Yeah.
It's juggling in the summer, but
is.
but I know what you mean. It feels like a blink. It's you're emptying out the backpacks and you're filling them back up. Before you know it.
I know it's at least for us it's some camps for the kids and a couple of overnight things, and we'll end up doing a couple of days here or there, a day trip or so. But yeah, no, you're right. You're moving on to the next thing and moving on after that. So there's always something going on.
It goes fast.
Yep. So we look forward to getting on again and having our next show up again. We encourage folks to certainly please reach out to us, and if you have any feedback, any shows you'd like to see, any opportunities out there for a show, you know, we'll be happy to hear them, happy to spotlight someone and you know, get out there and you know, certainly celebrate all the good things we have going on in Quincy.
Great.
Great. So again, thank you again, Ann.
Thanks.
Thank the crew here as well. They do some great work. You know, I know they've been working hard for us. So thanks everyone. Take care.
Thank you.